The pristine halls of Eastbridge Medical Center gleamed under the harsh glow of fluorescent lights, sterile and perfect. It was a place known for cutting-edge technology, elite physicians, and a long-standing reputation as the gold standard in suburban healthcare. Yet beneath its polished surface simmered a culture reluctant to change, steeped in unspoken rules and whispered prejudices. Let's find out before we dive into this story. Comment below where you're watching from today, and if you enjoyed this tale with unexpected twist and moment of justice, don't forget to subscribe.
Let's continue with the story. Danielle Harris stood in the break room, coffee in hand, staring out the narrow window at the gray sky hanging over Eastbridge Medical Center. The revelation from Mr. Whitaker echoed in her mind like a bell toll. The Monroe file was real, and now in her possession. But knowledge was a double-edged sword. Returning to work felt like walking a tightrope. Her steps were measured, her conversations cautious. The walls of Eastbridge hadn't changed, but Danielle had. She moved with purpose now, her eyes open to every microaggression, every unspoken rule. Only a few knew of the file's existence: Danielle, her attorney friend Maya Patel, and one trusted ally she hadn't seen in years, Marcus Hale, a former investigative journalist turned data analyst who owed her a favor. "Keep this off the grid," she told him. He agreed. "This rabbit hole is deeper than you think." Meanwhile, subtle sabotage continued. Equipment mysteriously vanished from Danielle's assigned cart. Her shift schedules were changed without notice. Her documentation was misfiled. But she wasn't alone. Nurse Amanda Chu, quiet and efficient, pulled Danielle aside one evening. "I read the article," Amanda whispered. "I know what you're doing. Just be careful. They protect their own." Danielle's breath caught. "Do you have something to share?" Amanda hesitated, then nodded. "I've seen them change patient charts, especially for Medicaid patients. Downcode symptoms. Limit diagnostics. It's not just bias, it's fraud. They arranged a system, discrete meetings, shared notes." Amanda wasn't the only one. 2 other staff members reached out within the week. Whistleblowers in waiting. The quiet resistance had begun. Marcus uncovered something chilling. An old internal audit from 8 years ago, signed by Thomas Whitaker, flagged over 200 cases of unexplained discrepancies in patient care. "Guess who buried it?" Marcus said over the phone. "Your friend Dr. Charles Renner. He chaired the ethics committee back then." Danielle felt her stomach tighten. "So he's been cleaning house for a decade." "And it gets worse," Marcus added. "Renner's connected to a private equity firm. They've been pushing budget cuts, pushing out senior staff, and pushing up profits." Danielle looked around the ward. Patients in understaffed rooms. Nurses stretched too thin. The pattern was clearer now. This wasn't just discrimination. It was systemic exploitation. Maya began drafting a legal brief. Danielle, Amanda, and the other whistleblowers compiled a secure dossier. They collected testimonies, documented chart manipulation, recorded hostile conversations. Then the breaking point came. A black teenager with sickle cell anemia came into the ER, writhing in pain. A junior doctor dismissed him as drug-seeking. Danielle advocated fiercely. They ignored her. The boy died 8 hours later. His name was Isaiah Crawford. Danielle stayed with his mother, who sobbed into her arms, broken and disbelieving. That night, Danielle called Maya. "It's time." The exposé dropped on a Monday morning. A joint effort between Maya, Marcus, and a national news outlet. Eastbridge Medical, profit over patients. Names were named. Evidence displayed. Danielle and others went on record. The hospital CEO released a vague statement about reviewing internal practices. But the fire had started. Dr. Renner vanished from the hospital roster by Wednesday. By Friday, the state health department announced an emergency audit. Danielle received hate mail, threats, but she also received letters of support from across the country. Nurses, patients, families, people who had experienced the same silent cruelty. She was invited to speak at a national healthcare equity conference. And at Isaiah's funeral, his mother hugged her tightly. "Thank you," she whispered, "for seeing my son." As Eastbridge Medical braced for impact, Danielle kept working. Thomas Whitaker's memory remained a guiding light. His quiet bravery. His buried truth. Danielle Harris awoke with a start. The early morning light bled through her blinds, casting fractured patterns across her bedroom wall. Her mind, however, was already back at Eastbridge Medical Center. The events of the past week replayed on a loop. Mr. Whitaker's cryptic warnings, the Monroe file, and the ominous sense that her every move was being tracked. Her phone buzzed. A text from Naomi Chen, her college friend and now legal counsel. "Naomi, we need to meet today. The hospital's internal team is aware someone accessed the basement lockers." Danielle's stomach clenched. She had expected fallout, but not this soon. She replied with a simple, "Lunch. Our usual spot." At Eastbridge, the atmosphere had changed. Staff were edgier. Conversations stopped when Danielle entered a room. Even patients seemed more withdrawn, some casting suspicious glances at her. Only a few, like Nurse Anna Morales and orderly Kevin Brooks, still treated her with warmth. She approached Ward C cautiously. Thomas Whitaker's room was dark, shades drawn. He was asleep, or pretending to be. His condition had worsened in recent days, his body giving way even as his mind remained sharp. Danielle whispered, "I found it, Mr. Whitaker. We're not alone in this." His eyelids fluttered. A faint smile ghosted his lips. "Good. Just careful. They don't like loose ends." She left him resting and continued her rounds, but her mind stayed with his words. Loose ends. At lunch, Naomi slid a flash drive across the table. "Encrypted files from the Monroe cache. I decrypted most of them. It's worse than we thought. Race-based triage patterns, altered patient histories, even suppressed malpractice claims." Danielle felt a chill. This could shut them down. Naomi nodded. "Which is why they're going to fight dirty. We need a media ally. Someone reputable. I made a few calls." Danielle hesitated. "We're risking everything." Naomi leaned forward. "We're protecting countless others. And honoring Mr. Whitaker's sacrifice." Back at the hospital, Danielle found a notice in her mailbox. Pending performance review. Scheduled meeting with administration. A thinly veiled threat. She returned to her locker to find a post-it note stuck to the door. "Not everything buried stays dead." Her heart thudded. Someone knew. That evening, as Danielle left the building, she noticed a black car idling near the parking garage entrance. Tinted windows. Engine running. As she walked by, the window cracked open. "Miss Harris," a voice called, smooth, male, unreadable. "You've made quite the impression." Danielle stopped. "Can I help you?" A pause. "We're offering you a way out. Walk away. Delete your files. Accept the transfer to another facility. Quietly. And if I don't..." The smile in his voice was audible. "Let's just say, accidents happen. Careers end. Stories never see daylight." She stared him down. "Then I guess I'll see you in the headlines." The window rolled up. The car pulled away. Inside her apartment that night, Danielle began drafting her statement for the press. She would go public, with or without hospital approval. The files would be released. The patients' voices would be heard. And if she had to burn the entire facade of Eastbridge to the ground to bring the truth into the light, so be it. The circle was tightening. But Danielle Harris was ready for war. The air inside Eastbridge Medical Center had shifted. Subtly, but unmistakably. Danielle Harris could feel it every time she stepped through the sliding doors, each greeting a little colder, every hallway conversation silencing as she passed. Word was spreading, though no one said it outright. She had found something, and she wasn't backing down. She kept her head down and stayed vigilant. With the help of her lawyer friend, Maya Langston, Danielle had begun preparing an official complaint to present to the hospital board. But time was running short. Whoever had ransacked her locker and slashed her tires wasn't going to stop at subtle warnings. In the staff break room, whispers hissed like steam from a kettle. "She's making a mess. Why not just leave?" Playing the victim. But Danielle had learned to walk through fire. That day, Mr. Whitaker's room was empty. Startled, Danielle rushed to the station. "Where's Mr. Whitaker?" Nurse Alvarez, the only one who'd ever shown her kindness, looked up, worried. Transferred. Administrative order. They moved him to a private facility in Wexford. No forwarding info. Danielle's chest tightened. Why? Just gone. No discharge summary. No record in the system anymore. It's like he was erased. Danielle left work early and drove straight to Maya's office. They're covering tracks. Removing witnesses. Maya nodded gravely. Then we accelerate. You need to go public. Tomorrow. That night, Danielle uploaded anonymized excerpts from the Monroe file to an encrypted drive. Charts. Testimonies. Data patterns. She crafted a statement, speaking directly to the systemic rot at Eastbridge, and emailed it to 3 investigative journalists known for uncovering medical malpractice. By morning, her inbox had exploded. One of them, Natalie Chen, from the Beacon Ledger, wanted to meet. They arranged to speak that evening in a quiet corner booth at a cafe outside city limits. Why risk this? Natalie asked. Danielle looked out the window at the rain. Because I took an oath. And because Mr. Whitaker trusted me. Natalie leaned in. This is going to be big. You need to be ready. I already am. Back at Eastbridge, subtle became sinister. Danielle received a warning from HR, unsubstantiated claims about patient misconduct, all baseless. She knew it was retaliation. Maya began drafting a whistleblower protection suit. But the pressure was mounting. Then, a message arrived in Danielle's inbox, untraceable, you don't know what you're playing with. Stop now. Before it gets worse. She read it 3 times before deleting it. Her hands were shaking. But her resolve never wavered. She turned to the camera on her laptop, hit record, and began to tell her story. This time, in her own words. See you in next episode. Don't forget to subscribe and share.